I'm Archana and I'm going to be talking about healthcare in United States. I personally believe that healthcare is a positive right, and we as Americans should have a universal healthcare system. Many would argue that if all of us need to be covered, where is the money going to come from? That is a good question, but let us look at the healthcare in US today. Spending on healthcare in United States has been rising at a very fast pace. In 2005, national healthcare spending amounted to about $2 trillion, and it's expected that by 2015 it will increase to $4 trillion. United States is spending at least twice as much per capita than any other industrial country, but our healthcare outcomes, they are not better, and sometimes even worse than the other developed countries. What does this show? This shows that the United States healthcare system costs the most in the world, denies care to tens of millions of Americans, and the international performance in quality is just so-so. What is wrong with this picture? Where did we go astray? It was not like this in the United States. Earlier, every person could afford to have medical care. It may not have been through insurances, it could have been private pays. Even when insurances were available, they were not as expensive as they are today. We have insurance industries that spend enormous amount of resources trying to identify who really needs the services. A chunk of the healthcare money is used for insurance. Companies bloated administrative fees, marketing costs, CEO salaries and bonuses, all of which could be eliminated by having a universal healthcare system. Also, let us look at another aspect of administrative costs. US has literally tens and thousands of different healthcare organizations, HMOs, PPOs, Medicare, Medicaid, billing agencies, etc. By having so many different payers of healthcare fees, there is a huge amount of administrative waste generated. Just imagine how complex it would be in a doctor's office when each insurance company requires a different form to be completed, has a different billing system, has a different billing contact, and a different phone number. It's very confusing. Healthcare providers are spending more time on insurance paperwork and less time seeing patients. They are being dictated on what they need to do with the patients. They have been forced to hire additional personnel to keep up with the abundant paperwork that the insurance has created. All this could be avoided by just having one payer system. One of the studies estimated that administrative costs and regulatory costs up to 31% of the healthcare expenditure in the United States, while that in Canada's rate of 16.7%. This definitely does not look good. We could remove all this cost, or at least reduce this cost, by having a one-payer system. Not only this, as a one-payer system, we would have a bigger buying power and we could control costs. Let us look at another aspect of where this money is going to come from. We already have a universal coverage for our elderly. Government already pays more healthcare bills than private insurers do. We already covered the expensive cases for the elderly and the cases when people get very sick and go bankrupt. The private sector pays a big chunk too. Then what is left? Mostly the people that are left are low-income working adults, and we pay an enormous amount not to cover them. It is seen that a minority of population generates most healthcare costs. In every age group in the United States, approximately 10% of the population occurs 60 to 70% of the cost. People with large medical care costs are often chronically ill, disabled, or poor. People without healthcare insurance are much less likely than those with insurance to receive recommended preventive services and medications, are less likely to have access to the regular care, and are less able to obtain needed healthcare services. Consequently, the uninsured are more likely to succumb to preventable illnesses and more likely to suffer complications for these illnesses. Our society's inability to provide continuous, coherent patient and care for this group of individuals is one cause of our high aggregate cost of healthcare. Thus, if we could cover this group, they would not be that sick when they came to the Medicare, when they came to the age of Medicare, and our costs would be cheaper. Thus, I believe that single payer is a very cost-effective method, and if we did it, we would be better off.